Hey everyone. So you've probably seen all those headlines about a new virus outbreak over in China, and you're probably thinking,
5 years after COVID, really?
right, like, haven't we been through enough? And it's totally understandable to be a little freaked out. We're going to do a deep dive today into an article from NDTV called New Virus Outbreak in China. What is HMPV? No symptoms, prevention tips, and more. Hopefully, we can get a better understanding of what exactly is going on with this HMPV and how worried we should really be.
Yeah, I mean, the timing is pretty bad. We're hearing reports coming out of China about hospitals being totally overcrowded and crematoriums overwhelmed, which
Yeah.
is obviously going to raise some eyebrows, especially after what we just went through with the pandemic. On top of that, you've got all this chatter on social media about multiple viruses going around.
Oh, great. Like what? Give me the
Well,
rundown.
there's talk of influenza, mycoplasma pneumonia, and of course, our old friend COVID-19 is apparently still kicking around.
So it's like a greatest hits of respiratory viruses.
Pretty much.
But,
But along with all of those, you've got this HMPV that everyone's talking about.
right, HMPV. So is there any truth to what people are saying online about all these different viruses hitting China at the same time?
Honestly, it's hard to say for sure. There are definitely those claims floating around, but China hasn't officially confirmed multiple outbreaks or anything like a state of emergency. But what we do know is that this HMPV is causing some serious concern. So let's maybe shift gears a little and try to understand what we're dealing with here. What exactly is HMPV and why is everyone making such a big fuss about it?
Okay, so HMPV. What is it? Is it just another one of those scary acronyms that's supposed to freak us out?
Well, the acronym stands for Human Metapneumovirus, but the virus itself is actually pretty common. For most people, it's going to feel a lot like the flu or a bad cold. It usually affects the upper respiratory system, but sometimes it can spread deeper into the lower respiratory tract, and that's when things can get a little more dicey.
So basically, it starts with the sniffles and a cough, but it has the potential to turn into something worse. Is that what makes this HMPV stand out from all the other respiratory bugs we deal with every year?
That's a great question.
Yeah.
See, the thing about HMPV is that it's kind of a master of disguise. The symptoms are really similar to a lot of other respiratory illnesses. Cough fever, stuffy nose, sore throat, you might even have shortness of breath. And because it looks so much like the flu or a common cold, it can be tricky to diagnose. You'd really need a specific test to know for sure if it's HMPV.
So it's like a chameleon virus. It blends in with all the others. If it's so hard to tell it apart from other viruses, how does this HMPV even spread? Is it like COVID, where it's mostly airborne?
It's pretty similar to how other respiratory viruses spread, mainly through those little droplets that come out when you cough or sneeze. You can also get it through direct contact with someone who's already infected, or by touching a surface that has the virus on it, and then touching your face or eyes.
Okay, so basic hygiene is our best bet then. Washing our hands, covering our coughs, maybe even breaking out the masks again. Speaking of COVID, does HMPV linger as long as COVID did? How long are we talking about in terms of being contagious?
Good question. So the incubation period, which is the time between when you're exposed to the virus and when you start showing symptoms, is usually 3 to 6 days. How long you're contagious really depends on how bad your case is. A mild case might only be a few days, but if you get hit harder, it could be longer.
So 3 to 6 days of wondering if you've caught it, and then who knows how long you could be passing it on to others. Not great. Does everyone get affected the same way, or are some people more likely to have a rough time with HMPV?
It's like most viruses in that anyone can get it. But some people are definitely more vulnerable to complications. Young children, older adults, anyone with a weakened immune system, they're the ones who are more likely to have a tougher time fighting it off and could end up with a more serious case.
So it's not something to take lightly,
No.
especially for those more vulnerable groups. You mentioned complications before. What kind of complications are we talking about here? How bad can it get?
Some of the complications can be pretty nasty, especially for those at-risk folks, like bronchiolitis. That's an inflammation of the small airways in the lungs. And then there's bronchitis pneumonia, even flare-ups of asthma or COPD for people who already have those conditions. In some cases, these complications can be serious enough to land someone in the hospital.
So while a lot of people might just feel like they have a bad cold, there's definitely the potential for things to take a turn for the worse, especially for people who are already vulnerable. So is there anything we can do to protect ourselves? Is there a vaccine for HMPV, or are we out of luck there?
Here's the thing. There's no specific antiviral treatment for HMPV right now, and there's no vaccine to prevent it either.
Okay, no vaccine, no specific treatment. That's not what I wanted to hear. So if we can't just get a shot or pop a pill, what are our options? Are we just crossing our fingers and hoping for the best?
Not necessarily. There's still things we could do even without a vaccine or a magic pill.
Okay. I'm all ears. What can we do to protect ourselves from this HMPV? Okay, I'm all ears. What can we do to protect ourselves from this HMPV?
Well, it really comes down to those good hygiene practices that we all know we should be doing. But let's be honest, most of us could probably do a little better.
Washing our hands regularly is crucial, like with soap and water, for a full 20 seconds.
Yeah, I'll admit I'm guilty of just doing a quick rinse sometimes. I don't always hit that 20-second mark.
Yeah.
So what else could we do besides hand washing?
The same rules apply for coughing and sneezing. Cover your mouth and nose, ideally into your elbow or a tissue. And even though we might be tired of them, masks can still be helpful, especially in crowded or enclosed spaces or if you're feeling a little under the weather.
So basically a lot of the same stuff we were doing during COVID. It makes sense that those basic precautions would help with any respiratory virus. But what happens if you actually get sick? What's the best course of action if you think you might have HMPV? The most responsible thing to do is to stay home and isolate yourself from other people. You don't want to spread it around. Yeah. Drink plenty of fluids. Over-the-counter meds can help with the symptoms, and if you're in one of those higher risk groups or if your symptoms start getting worse, it's always a good idea to talk to your doctor.
So good hygiene, masks when necessary, and self-isolation if you get sick. All good advice, even beyond this HMPV thing. But this whole vaccine situation has me thinking, what does this mean for the future? With all these new viruses popping up all the time, what lessons can we learn from COVID that we can apply to these new threats, especially if there aren't any vaccines available?
That's a really important question. COVID was a real eye-opener when it comes to being prepared for pandemics.
Ah,
One of the biggest takeaways is how important early detection and surveillance systems are. The sooner we can identify a new virus and figure out how it spreads, the better chance we have of containing it before it gets out of control.
that makes sense. But how do we actually improve those early detection systems? It's not like we can predict when and where the next virus is going to show up.
True, but we're not completely in the dark. We've got some pretty powerful tools at our disposal now, like genomic sequencing and data analysis. They can help us identify new viruses super quickly and track how they mutate. We also need to invest in public health infrastructure, things like rapid testing and contact tracing. Those are essential for finding cases early and isolating them to break the chain of transmission.
So investing in technology and public health is crucial. Sounds like a lot of work for governments and health organizations. But what about us, regular people? Can we actually do anything to help prevent future outbreaks?
Absolutely. Individual actions can have a big impact. It's not just about washing your hands and covering your coughs. It's about seeing yourself as part of a community when it comes to health. Staying informed about potential threats, following public health guidelines, even advocating for better policies. All of those things can help build a more resilient society.
So it's about taking responsibility for our own health and realizing that our choices affect not just ourselves, but the people around us. We're all in this together.
Right. Exactly. We need to stop with all the fear-mongering and focus on giving people accurate information so they can make smart decisions. Clear communication and public education are key to building trust and encouraging people to do the right thing.
Right. Instead of panicking and hoarding toilet paper, we need to stay calm and informed about how to protect ourselves and others. But one thing I'm curious about is, during COVID, we saw how certain communities were hit harder than others. How do we address those inequalities in healthcare and make sure everyone has access to the resources and information they need to stay safe?
You're bringing up a really important point. Addressing those health inequities is absolutely essential if we want a strong and fair healthcare system. We need to invest in communities that are often overlooked or underserved, make sure they have access to healthcare testing, accurate information. It's about creating a system where everyone has an equal chance to protect themselves and their families.
It sounds like a huge undertaking. But ignoring those disparities is only going to make us more vulnerable as a society when the next outbreak hits. And speaking of global outbreaks, we can't forget the viruses don't care about borders. What role does global cooperation play in all of this? How can we actually achieve that when different countries have different priorities in healthcare systems?
Global cooperation is absolutely crucial. Infectious diseases don't discriminate. A threat in one part of the world is a threat everywhere. We saw with COVID how a lack of coordination and information sharing can really screw things up. We need countries to work together on data sharing research and the development of vaccines and treatments. It's in everyone's best interest to work together to prevent and control outbreaks before they become global pandemics.
So a more unified approach to global health security. It sounds great in theory, but is it really possible? COVID showed us how quickly things can fall apart, even with organizations like the World Health Organization trying to coordinate everything.
Yeah.
How do we move beyond national interests and create a truly global response system?
It's a tough challenge, but it's not impossible. We need to strengthen international partnerships and create clear guidelines for sharing information and resources during outbreaks. Things like transparent reporting of outbreaks, standardized data collection and analysis, coordinated research efforts. And we also need to tackle issues like vaccine equity and making sure all countries have the resources they need to protect their people.
It's a tall order, but it seems like the alternative is to keep making the same mistakes and scrambling to catch up every time a new outbreak happens. So, beyond global cooperation, are there any other big picture things we can be doing to prevent these outbreaks from happening in the first place?
Definitely. One important area is addressing the root causes of what we call zoonotic diseases.
Zoonotic diseases, those are the ones that jump from animals to humans, right?
Exactly. A lot of these emerging infectious diseases like COVID, SARS, MERS, they all started in animals and then spilled over into human populations. So if we can understand those spillover events and figure out how to prevent them, we have a better shot at stopping future pandemics.
Okay, that makes sense. But how do we actually do that? Do we need to avoid all contact with animals?
It's not about cutting off all contact with animals. It's about understanding how human activities can increase the risk of these spillover events. Things like deforestation, habitat fragmentation, intensive agriculture, the wildlife trade. All of those things create more opportunities for viruses to jump from animals to humans.
So it's about recognizing that human health and the health of the planet are interconnected. Our actions have consequences, and we need to be more aware of how we're impacting the natural world. What else can we do to be more proactive?
Another crucial area is strengthening health systems around the world. That means investing in healthcare infrastructure, training healthcare workers, making sure everyone has access to affordable healthcare, building up our ability to quickly identify and respond to emerging threats. When health systems are weak, they're much more vulnerable to outbreaks and less equipped to deal with them.
So it's about building a more resilient healthcare system that can handle not just everyday illnesses, but also potential outbreaks. It sounds like this requires a major investment of resources and a long-term commitment to improving global health.
Absolutely. It's an ongoing process, and it's going to take collaboration between governments, international organizations, and the private sector. And we can't forget about the importance of research and development. We need to prioritize research into new vaccines, antiviral treatments, and diagnostic tools for these emerging infectious diseases. We can't wait until an outbreak happens to start looking for solutions.
We've covered a lot of ground in this deep dive, from the specifics of HMPV to the bigger picture of pandemic preparedness. It seems like there's no easy fix, but there are definitely things we can do, both individually and collectively, to protect ourselves and build a more resilient future.
You've summed it up perfectly. It's about recognizing that our health, the health of our planet, and a proactive approach are all connected. We can't afford to be complacent. We all have a role to play in building a safer and healthier future for everyone.
It's a lot to think about, but it's conversation we need to have. Before we wrap up this part of our deep dive, I want to touch on something that often gets overlooked when we talk about viruses and pandemics: our own immune systems. Before we wrap up this part of our deep dive, I want to touch on something that often gets overlooked when we talk about viruses and pandemics: our own immune systems.
Yeah, that's a good point. We tend to focus so much on those external threats like viruses and bacteria that we forget about the amazing defense system we already have inside us.
Exactly. It's easy to get caught up in all the talk about vaccines and antivirals, but at the end of the day, it's our immune system that's doing the hard work of fighting off these bugs. So how can we give our immune systems a fighting chance, especially against these respiratory viruses that seem to be everywhere these days?
Well, there's no magic bullet, unfortunately. But there are a few things we can do to support our immune health. And it all starts with those basic lifestyle choices that we know are good for us. But let's be real. Most of us aren't exactly living our healthiest lives. A balanced diet is key. Plenty of fruits, vegetables, whole grains. Those give our bodies the nutrients they need to function at their best.
So all that healthy eating stuff our parents used to nag us about actually matters. What about exercise? Does that play a role in immune health?
Absolutely. Regular physical activity is super important. It helps improve circulation, reduce stress, and it actually strengthens the immune system, making it more efficient at fighting off infections.
All right, so healthy eating, regular exercise. Got it. What about sleep? We all know we need a good night's sleep to feel our best, but does it actually affect our immune system?
Big time. When you're sleep deprived, your immune function takes a nosedive. Your body needs that restorative sleep to repair and recharge, and that includes your immune cells. Aim for 7 to 8 hours of quality sleep every night to give your immune system a chance to rest and do its thing.
Yeah, I definitely notice a difference when I'm not getting enough sleep. It's like my immune system goes on strike right when I need it the most. Are there any other lifestyle factors that can mess with our immune systems?
Oh yeah, Stress is a big one. Chronic stress can really weaken the immune system, making you more susceptible to infections.
Yeah.
When you're constantly stressed out, your body is in that fight or flight mode, and that takes a toll on your immune defenses.
Stress is sneaky like that. It can creep up on you, and then bam, you're coming down with everything.
Yeah.
So what can we do about it? How do we manage stress when it feels like the world is constantly throwing curveballs at us?
It's all about finding what works for you. Figure out what helps you unwind and de-stress and make time for it in your routine, whether it's exercise, meditation, spending time in nature, listening to music, connecting with loved ones, whatever helps you relax and recharge.
So it's about finding that balance between taking care of our physical health and our mental and emotional well-being. It's all connected.
Right? Exactly. It's a holistic approach to health. We can't just rely on vaccines and medications. We need to empower ourselves by making healthy choices that support our overall well-being.
And that brings us back to the question we started with. What does it mean to live in a world with all these new and emerging viruses? It means we have to be proactive, not just reactive. It means taking responsibility for our own health and making choices that support a strong immune system.
It also means recognizing that we're all in this together. Our individual choices affect not just ourselves, but our communities and the world around us. We have a responsibility to protect ourselves and each other.
So it's about finding that sweet spot between personal responsibility and collective action. We can't control everything, but we can control the things we put into our bodies, how we manage stress, and how we interact with the world around us.
And that's a powerful message to leave our listeners with. We're not helpless in the face of these threats. We have the power to make choices that protect ourselves and contribute to a healthier future for everyone.
Well, that's a wrap on our deep dive into HMPV and the future of global health. We hope you found this information helpful, empowering, and maybe even a little bit inspiring. Remember, knowledge is power, and taking care of ourselves is an act of both personal and collective responsibility. Stay curious, stay informed, and stay well.